Do you know that your feet can warn you about liver problems before any medical report does? Yes, your feet. Today, I will show you the shocking foot-liver connection and 10 signs you must never ignore. Before we start, these signs only give a general idea that something may be wrong with your liver. For exact diagnosis and treatment, always consult your doctor and get proper medical tests done. But yes, these signs can warn you early before things get serious. So what's the foot-liver connection? Your liver and feet are strongly connected through circulation, heat control, and detox. So when the liver is stressed, overloaded, or inflamed, your feet are usually the first to send warning signals. Let's go through them one by one. First, red pinpoint spots on lower legs. If you see tiny red spots on your lower legs, that can mean poor circulation. And poor circulation can happen when the liver is struggling. These spots can appear in diabetes as well, but they are very common with liver issues. Second, varicose veins, spider veins, or enlarged veins. In this condition, your veins appear red or blue, enlarged and clearly visible. This can happen when the liver develops scar tissue, known as liver cirrhosis, and blood flow becomes slow and weak. When the liver shrinks or hardens, these veins become more visible. Third, cracked heels. Cracked heels can also be a sign of poor liver health. This usually happens due to deficiencies of vitamin B3 or omega-3 fatty acids. If your liver is not functioning properly, your body cannot absorb these nutrients well, which can lead to cracked heels. So here's what happens. The liver produces bile, and bile is essential for absorbing fatty acids like omega-3. If bile production decreases due to liver problems, your absorption of omega-3, vitamin A, vitamin E, and other fat-soluble vitamins also decreases. These vitamins are very important for skin health. So if bile is low, absorption drops, which leads to cracks in the heels. Fourth, itching or pain in the soles of your feet. If the bottom of your feet constantly feels dry or itchy, this may also indicate congestion or inflammation in your liver. When the liver is not filtering properly, bile salts enter the skin, causing itching, dryness, and irritation, especially on the feet. If there is frequent pain in the lower feet, this can also be related to liver issues. Fifth, very strong foot odor. If your feet smell extremely bad when you remove your shoes, this can also indicate poor liver health. The liver's job is to remove toxins from the body. If your liver function is compromised, toxins may not exit properly through urine or stool. Instead, they may come out through the skin. Since the feet are the lowest part of the body, gravity pulls fluid downward. Toxins often accumulate and cause strong foot odor. Sixth, pitting edema or swollen feet. Pitting edema is another common sign of liver failure. If you press on a swollen area and it leaves a small dent, then slowly returns to normal, that is pitting edema, and it happens when liver doesn't make enough albumin. Fluid leaks out of the blood vessels and collects in the feet, and this causes pitting edema. Next, white half moon under the nails. If the white moon-shaped area at the base of your nails becomes bigger than normal, it often means poor circulation, which can be related to liver issues. Eighth, hot feet at night. If your feet feel burning hot at night, this can happen because the liver can't regulate body heat properly. As a result, excess heat escapes through your feet. Ninth, discoloration around feet and ankles. Dark patches, yellowish skin, spider-like veins, these appear when detox slows down and waste builds up. 10th, cold feet, numbness and tingling. If your liver is sluggish, circulation slows down. This leads to cold feet, tingling, and numbness, especially at nighttime. Now, why do liver problems happen? There are many possible causes. First is liver toxic medications. Some medications are really harsh on the liver, and that can cause liver damage. Second, excess alcohol. Heavy drinking damages liver cells. Third, poor diet. If you don't eat fruits, vegetables, or salads and instead consume a lot of junk food, this acts like poison for the liver. Fourth, processed or half-cooked foods. Ready-to-eat or highly processed foods burden the liver. Fifth, too much sugar. High sugar intake causes liver toxicity. Sixth, excess protein consumption. Too much protein increases nitrogen in the body, making the liver work harder. Seventh, very spicy or oily foods. These can negatively affect your liver as well. Now, why does your liver affect your feet? What's the connection again? The liver controls detox, blood filtration, heat balance, protein production, and fluid balance. When any of these functions weaken, your feet shows the first warning signs. Why? Because your feet are the farthest part from your heart. So they get blood, nutrients, and oxygen last, which means any problem in the liver shows up in the feet sooner because they are the most sensitive to changes in circulation and detox. Now, here are some home support for foot and liver health. Some simple habits that you can add to your routine. These are not medicines, just supportive habits. First, drink enough water. Keep yourself hydrated. Next, eat fewer fried, oily, or heavy foods. Add more fruits and veggies to your diet. Next, cool water foot soaks for hot, itchy feet. Next, moisturize your heels daily. Wear breathable cotton socks. Avoid tight shoes that reduce circulation. But again, if symptoms continue, see your doctor immediately. What's the final message? Do not ignore these 10 signs. Your feet are not just feet, they are warning lights. When the liver struggles, your feet show early signs like heat, itching, swelling, odor, discoloration, numbness, and red spots. If any of these felt familiar, your liver may be asking for help. Don't wait for things to get worse. Talk to your doctor immediately. Get tested and take charge of your health today. Share this video with someone who needs this information. Stay aware, stay healthy, and keep listening to your body. I'll see you soon.